Welcome to
Good
the
evening.
seventh of the Master Trainer program. And today's topic of discussion is managing and resolving complaints. I think this is one thing that we all handle every day. For some or the other reason, it could be a complaint or it could also be some request coming from the patient or patient's family. And a lot of times, when these complaints are not handled well, we do see some kind of repercussions of these kind of situations. So, just to share one experience with all of you, this happened, of course, long ago, but then I couldn't forget the incident because I saw this happening personally. So it was a gynec friend of mine who had a small nursing home, and a woman, and it was normal health me. And she was discharged after 2 3 days of hospital stay. She came for follow up after another say 3 4 days of 1 week for the just to get the follow up done. So she talked to the lady, she saw the patient, and then she asked the staff on duty, sister, iski dressing kar do. She had episiotomy, so basically, probably she just wanted that to be cleaned and checked if wounds are healthy. I mean, the sutures are healthy and whatever it is. So the patient's husband, who was sitting just next to the patient or in the same room, he said, "Doctor साहब आप कर दीजिए, आप कर दीजिए." So the doctor incidentally did not realize what was his intention. So in a little rude tone, she said, "अरे भैया ये nurse का ही काम है, वही करेगी." And uh, the lady was attended by the nurse on duty. She was sent back. This person who was this patient's husband was a small-time journalist. He got little, upset with the way she had responded to her in a little rude way. You wouldn't believe that he literally, went complaining against her in all possible departments that were, that had anything to do with the nursing home, be it biomedical waste, be it building bylaws, be it nursing home act, be it, electricity, water, everything, anything and everything that could disturb her. Almost like for the next 5 6 years, she kept having somebody or the other coming from some department with some complaint and some file, and when these people come, they don't just leave simply by listening to you. I think she had to literally spend something like 5 6 lakh rupees just to get rid of all these things. And the mental harassment I believe she must have experienced or she must have gone through, I think we all can well imagine. So, what I'm trying to bring home is sometimes we don't understand the seriousness of the situation, and it can really be very, very, unsafe to handle requests or complaints of the patient. So, if I may ask you, if briefly you could tell what kind of complaints you get to hear from your departments. Just say the broad areas. I don't want to hear the complaint because we will be talking about it in a minute. But what kind of common complaints or what issues are normally brought up for as a complaint or as request in your hospitals? You can unmute and speak, but be brief so that everybody gets a chance to speak. Okay, Dr. Purnima has written in the chat box, long waiting time. I think that's one of the very common problem we get to hear from patient party, and absolutely, I agree with you, Dr. Purnima. What do others say? If you want to write in the chat box, nothing like this, because that would save time and everybody will get a chance to share their thoughts. Yeah, doctors spending less time with the patient. I agree. This is also a very common complaint that I was not attended properly, I was not heard. Yes. Discharge on time. Yeah, delay in discharge, I think is that you're trying to say? Because the moment they hear discharge means they expect that okay, file is ready and they go. But they don't know
Yes,
the process and
delay
the
in
time.
discharge.
Absolutely. I completely agree. So yes, rude behavior is one thing. I agree. Ravinder has also mentioned, and Jana has also mentioned the same thing. Very often we get to hear complain about the behavior of the staff. I agree. Then no one is listening to my concern. Yes, that's also a very common complaint. You will get to hear that. I mean, there's nobody who's attending to me. I went and told something to the nurse, and she said, "Okay, I'll speak to my senior or my management," but she doesn't come back with any proper reply. So there's a dissatisfaction. Registering Dr. Purnima, what is it registering? You
Madam,
unmute.
some cases require registering of a medical legal case.
Okay, MLC, it is MLC. Okay, sorry, it was written in small letters. Right? Yeah, so they don't want MLC to be written. I agree. They would want that. I mean, let's do away with this. So very often we get to hear this. Okay, and then also inadequacy of the nursing staff. That also, because if the nursing staff is not trained or they are not qualified to handle. In a lot of hospitals, like I think I mentioned in the last session also, that I've seen in they will not even hire a nurse, they will hire an A&M and or even sometimes technicians, and they will make them wear white uniform, and nobody knows whether they are actually qualified nurses or not. And then you get to hear that they are not adequately trained or qualified. Yes, visitors access, that's also a problem, especially if they want to visit their patient in the ICU. So normally we restrict, and they want to talk about that. And then wrong medication administration, yeah, that's also a complaint. Dietary department deficiencies, yeah, the food quality is not good, food is cold, or it is not on time, or it's not tasteful. Yes, I agree. Dr. Razak has probably shared his personal experience, and he says, yesterday my child was okay. 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 This is the complaint that you're talking about, Dr. Razak. Am I right? Yesterday my child was okay, and the doctor also told us my kid has improved, but today my child deteriorated, and doctor now advised us to shift my kid to PICU. I agree. And then they're, because especially if they don't know why that happened and what exactly was the status and why this could happen, they definitely are very dissatisfied. I agree. Then procedure not explained or informed properly. Yes, I agree. I think this is also a very common complaint, that I was not told about it. I was not even sometimes even the financial part. They say I was never done financial counseling. I was not explained that this will be the expense, and now you're. So if I may ask you, uh, who normally attends to these kind of complaints in the system? Who is responsible for attending to these complaints? Dr. Bijoy, because you joined late, for your information, we are discussing managing and resolving complaints.
Okay.
Yeah, we have just started the discussion, and we talked about what kind of common complaints we get to hear from patients and their family members.
Okay.
Yes, Dr. Abhishek.
I guess many a times, if I have to share what I do is, if it is all these dietary department nursing inadequacies or even junior doctors sometimes not being there, I try to assuage it as much as possible. But if it's something beyond, like if there is financial, some little bit of billing here and there, I try to answer, but then I do direct them to the requisite department. But I think my hospital also has PROs and others who do handle these kind of complaints on a day-to-day basis.
So that means, as you are saying, you may handle yourself. A lot of time when you are there and if you are around, you definitely handle it yourself. What about other hospitals? Normally, who handles regular complaints about long waiting time or not being informed? So if you want to unmute or if you want to write in the chat box. Okay, Dr. Purnima says resolution starts with the one who receives the complaint. Absolutely, I think you're spot on, Dr. Purnima, and I think this is what I wanted to say. I will come back to your reply once again. Dr. Som says complications of surgery were not explained before procedure. For example, total knee replacement was done and patient had complained that it was not told before surgery that I cannot sit on floor anymore. Yes, a lot of time this kind of complaints you will get to hear from patient. They were not fully explained what they will be able to do or they will not be able to do. I completely agree. Yeah, so Dr. Purnima, what you are saying is absolutely right. Though we think that there will be a grievance officer, or there will be a patient relation officer, or there will be a patient care coordinator who will handle it, but actually it is the first person who is attending the patient. It is not every hospital will have a grievance officer or a patient relation officer. So that means each one of us should be trained how to handle complaints, how to address their grievances, or how to handle their request. It is not just the frontliners, it is not the middle management, it is not the seniors, it is each one of us should know how to handle these situations. By the way, why should we handle these complaints? Why should we handle the complaints?
Madam,
Or
may I contribute to this discussion?
sure,
That
sure.
when we say that the resolution starts with the person who receives the complaint, even in directing it to the correct person,
Hmm,
or listening patiently, not brushing it off, and directing the person that yes, your complaint has been noted, and
hmm,
this is where you have, this is the line which you have to follow, is also handling a complaint. And if
absolutely.
designated official for it, or even if there's an immediate superior, the way you listen to the complaint is also handling the complaint. So that's why resolution starts with the person where it is voiced. Thank you, ma'am.
So that means if there's a proper system where we first receive the complaint and then we know how to escalate, whom to escalate, or if you can handle in your own capacity. And of course, initially, I feel each one of us should be able to handle it, because ultimately, if everybody is just escalating it to some one person, again, that person is going to be handling a lot of issues. It becomes sometimes impossible to address all issues, and then there's a delay in response, and then there's dissatisfaction even for that. So that means I personally feel each one of us should individually know how to handle a issue. But for example, if it's something financial concern and I know I can't handle it, then I have to refer the person to the right person who can address this. So that's how I should be doing, because with junior staff, if you'll say, I mean, escalate it to the other person, then there will be a way, that instead of handling it themselves, they will just pass the buck to the other person. That's also one of the flip side, if you just ask them to escalate to others. So I'm coming back to my question. Uh, why is it important to address their complaints or address their request? Why is it important?
Madam, it is our duty to attend to our consumers, and it is a part of our medical duty. It is part of our legal duty. So, definitely, a complaint which is voiced has to be attended to. It cannot be brushed up.
Okay, but then we all know a lot of time we do not take complaint very seriously. We don't take any action. Sometimes we are not even proactive in managing this situation. So, what ill effects do you think would have if we don't address it promptly? Somebody else, if would like to contribute. If we don't address the complaint, what is the risk?
If the complaint is not attended on time, the problem can
Mhm.
be aggravated, and it may go to a different. It may take a different shape.
So definitely, if the patient's concern is not addressed, there will be dissatisfaction. I can read Raminder has written, pay for patient satisfaction and to improve the quality of care, one should, yes, of course. Bad word of mouth. Then I completely agree with you. A lot of time, and now it is not just the bad word of mouth. The problem is people go and write poor reviews on Google about the hospital, about the doctor, about the system. So yes, as we mentioned by Dr. Som, there is a loss of reputation of the hospital and also of the treating team and department. We get to hear such kind of reviews on the Google. Absolutely. Then of course we all know that there is a risk of medical legal issues. Absolutely, that's also true. There can be medical legal issues. There can be violence because of it. So even that's one of the risks when you are not addressing their concern. They can become aggressive, they can become violent, they can call media, they can call police. I mean, we have seen such cases where they don't hesitate engaging others. And Dr. Razak has mentioned we are not able to know our weaknesses. Absolutely. I think if you address complaints and resolve them, it is one of the way to improve. Yeah, Dr. Bijay has also written the same thing. It's one of the ways to improve yourself. Rather, when you get these complaints and when you get this feedback, that's a way to find out the gap in our services, where we need to improve, what we need to improve, how we need to improve. So even that can be learned, provided we are open to feedback or complaints or suggestions or requests that come from people. And if we promptly take action, a kappa will be a great tool to apply in such situations where you not only address the complaint but you also make sure that these things do not happen again. So that means if we attend those things promptly and handle them properly, not only you will win back your patient. See, a lot of time people will come up to you with complaint or some grudge, but when you are able to handle them, it's actually second opportunity to win back your patient. And of course, they will go and talk good about your hospital and about you, that, oh, they're very nice. Even if there was a problem, they promptly handled and they sent me satisfied. That's how people even write reviews, that I had a problem, but then they were very prompt in rectifying it and they attended to my complaint or my request. So all in all, I think patients' words are very important, and it's important to value them as a feedback, as a way to correction, and also to send them satisfied. Also, when a system works in this manner where we address patients' complaints, seriously and promptly, even employees are satisfied. They feel good that yes, we have a system where a patient complains, and also when you listen as administrator, your staff also behaves in the same manner. So just today I was talking about some system. The man who holds the system was not very courteous with the clients, so his staff was also misbehaved. So there's a quote in Hindi: "Jaisa Raja वैसी प्रजा." जैसा राजा वैसी प्रजा. So the kind of conduct you will demonstrate in front of your staff will automatically imbibe that way of handling patients' complaints. So if you are prompt, if you are respectful, if you are proactive, your staff will also not only become more responsible, but they also will feel happy that we are on the way to improve. So that means we are creating a culture where we are wanting to give quality service to our patients and their family members. So going further, I think we'll take a role play. We'll do a role play, because that's a very good way to see how we handle and what can be done and how we can make ourselves better. So I'm going to share, uh, uh, a situation with all of you. I want you to first see the situation, and then you volunteer who wants to be the doctor on duty or the officer on duty, and who wants to be the patient party. Give me a second to uh, share the situation with you. So I hope my screen is visible to all of you. It's loading. So I request all of you to first read this situation, and then we discuss further. So if you have read this situation, I'll stop screen sharing. Can I stop? Everybody's okay?
Yes.
Okay. Thank you. Great. So briefly, this is a situation: 75 years old patient in the ICU with multiple comorbidities. Unfortunately, soiled his clothes while using the urinal. And the nurse and the attendant who were changing the patient's clothes, they were a little rude and rough in handling the patient. Attendant could sense it. Personally, he has witnessed this, and also he could sense from his relatives' expressions. Immediately, he did not intervene, but when the family discussed, they felt that's not the way they should have. Now they have come up to you requesting that take action, call her, ask her to apologize, or whatever punishment you want to give her. Please give that punishment, otherwise we'll involve media and police. So who would like to play the role of the officer or the doctor or the nurse or the sister in charge or HR, whoever? Jana, will you be?
Yes, doctor.
Okay, great. So Jana, imagine that they have come to you. Take that you are grievance officer. Is that okay?
Okay.
Okay. Okay. Now I want two family members who would be acting as patient's attendant. We don't require patient because patient is in ICU, but two family members. One of them who was there when this whole thing happened, so you have personally witnessed it, and one more who is really upset about it. Two volunteers. Somebody who has not played any role play. So I want Anu. Yes or no? No. See, ultimately, we have to become comfortable with role play. As a trainer, as a facilitator, please remember role play is one of the best ways to help people learn.
Agree, ma'am. But it is related to the hospital setting. I won't think that I'll be performing nicely.
Okay. Okay, no,
Is it-
but I'm giving you the role of an attendant. I'm not asking you to work as a hospital.
I don't
take
know
the role of
whether
your
I'll be able to play this or not.
because your family member. Will you not be upset about it?
Can I go with the second role play?
Okay.
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 Thank
There's
you.
no second role play this time, but there will be next time. Please remember to volunteer.
Definitely. Thank you, ma'am.
Okay, great. So who has Dr. Razak? Will you be the attendant? If you are comfortable. Yes or no? Please communicate.
No, no, ma'am. No, ma'am. No, ma'am.
Okay, no. Okay, no problem. Mr. Vijayaraj, I want you to play the role of the attendant. Is that okay? No, I think I will just nominate. I'll not ask you to volunteer. Because if you're not volunteering, then I have to your responsibility. Dr. Vijayaraj, will
Okay.
you be? Okay,
Yeah,
great.
I will.
Okay, and Dr. Bijoy, will you be? Okay. So imagine that Jana is the grievance officer, and case you both know, and it's 75 years old patient. He's your father, both of your brothers, and you have discussed between you. You're upset about the whole thing. Now you have come to her, and you're asking, and you have to insist on that you have to call her and make her apologize. And let's see how Jenna helps it. Okay. So we'll all switch off our video. I request everyone to observe the role play, make notes of what you observe, and then when we have discussion, share your thoughts about it. And Jenna, if I come in, that means I'm going to requesting you to pause there.
Okay.
Dr. Bijay, you want to ask something?
Last time I was the doctor. This time I got the chance to give back. Can I use it?
You know, of course. See, the whole idea of these role plays is we want to learn to handle difficult situations. Easy situation, easy relatives, I don't think that's something to learn. We all can do. The patient part is nice, well behaved, they are in their senses, they'll be very reasonable. Problem is when they're overwhelmed, they are not reasonable. And we are unhappy about it, but they are also unhappy. And they're quite right in their place. When you take that role, then you get to realize how a family feels when your patient is not treated well.
Yeah.
I think that's also empathy. Okay, so we'll switch off our videos and only 3 of you will be visible. Jenna, Mr. Vijayaraj and Dr. Vijay. Okay, go ahead, please.
Doctor, we have a serious issue to raise with. Hello?
Yes, I'm
Yes,
a grievance
yes,
officer
yes,
right now.
Yes, doctor. Our father is admitted here, and last time my brother was there. He was the attendee of the patient.
Can you just tell me the name of your father and where is he admitted?
Mr. Sharma? He's admitted in ICU.
Mr. Sharma is admitted in CCU.
Yeah,
Bed number?
Bed number 72.
Okay, yeah. Tell me.
Yeah, he was in the hospital and he just soiled his clothes, and the attending sister was behaving so rudely with my father. And this is not acceptable. So I just want you to look into it. I think you can ask with my brother. Actually, what happened, he can talk about it.
Yeah, tell me, doctor. Your brother can say something, what exactly he felt? Dr.
As far as I heard, the
Yeah.
problem is actually he just soiled his clothes, and the sister was misbehaving with him while changing and helping him, and it's not acceptable. So this is not the standard of quality which we
Yeah.
expect from this hospital. So I want you to intervene in this immediately. I want you to call the doctor, call that concerned staff, and I want you to apologize to our family, to the patient, and the whole family of us, because this is not what for we have come here.
Yeah,
So
Doctor,
I think you want to, because you have been giving a lot of ads in the media about the standard of quality, standard of care, all those things which you are providing. And if
Yes.
one sick patient and he's soiling his clothes, and sister is getting rude with him, this is simply not acceptable. This is simply not acceptable. So
Yeah, Doctor, I understand what has happened, but I'll look into it. But I think there was a problem there. There were 3-4 patients who were soiled at the same time, and the same particular nurse was doing it quickly for them. So maybe in that process something has
no,
gone
that's
wrong.
not. No.
I will make sure. I will make sure
She
that
badmouthed her. She was using some wrong terminologies. Her
I'm
whole
sorry
expression.
about it. I'm
Even
sorry
my
about
father.
it, Doctor.
No. Even my
I will look
It
into
is
the
not
matter.
acceptable. Your sorry is not acceptable. We cannot take it. You cannot take it. Because she was even using a bad way of language, her expressions. Even my father, who was sick, was even visibly upset about it. So I think your sorry won't suffice. No, we cannot accept it.
I'm sorry what has
No,
happened to the
I'm
patient,
thinking
Doctor.
to post a Facebook
In
post and
future,
put all
it
the
will
media
not be
persons
done.
and
But
all.
yes,
Right now, I want you to call that nurse, and I want you
yes,
to
I'll do that.
apologize
I'll
to
do
my
that,
father.
Doctor. I'll do that. I'll just see where she's doing right now, which patient she's taking care of right now. Hardly she's free. I'll get her to you, and yes, we will discuss about it, and I will ask her to apologize. And I'm sorry about it. It will not happen again.
Actually, I was waiting for Vijayaraj to intervene, so that only I
Yeah,
gave.
yeah. I was waiting for you to just take a pause, not interrupting you. Just
I was
but you are
expecting that
going on
somewhere,
and on,
somehow you will intervene so that I can stop.
Yeah, but you are going like, as though you're firing a gun. So I was just thinking, when are you going to wait? Like, when can I intervene? I was just finding a opportunity to speak in the middle. So anyway, if that really went wrong, then I'm.
I called brother. You are supposed to be my brother to intervene.
Yeah. I know. So I
Sorry,
am
I
very
couldn't
sorry.
make it worse. Sorry, Jena, I couldn't make it worse.
No problem. It's okay.
I thought that you're going to just give a little pause, so I could just come in, but just moving on and on. Like anyway,
So given a chance, what would you have said, Mr. Vijayaraj?
I would have said that this is not done. What has been going on is something which I can't really tolerate. Please look into it. What is it that is happening? It's really undone.
Okay. Jena said, I will, very, very, sorry, Jena, but very typical way that we say, okay, let me look into it. Let me talk to my team. Let me talk to my staff. Let's go into phase 2,
Yes, Doctor.
where Jena has spoken to her staff. Jena, is that
Yes.
okay? Are you
Yes,
ready for the next part 2?
Yes, Doctor.
Okay. Now assume that you have spoken to your staff. Now
Yes,
you know the fact. You have checked with her. And all of us again will switch off our videos. This time, Mr. Vijayaraj, now you will, take the lead in talking to Jana. And let's see how Jana handles it. I think we want to focus more on that. Give her a
Okay, fine.
chance. Give her a chance to handle it. And Jana, you have to take that. They will not. No patient family will give you a chance to speak. You will have to
Okay.
see how. Okay, go ahead, please. And we are switching off our videos.
Yes, Dr. Bijoy and Dr.
Ye-
Vijayaraj. I
Yeah.
just discussed with the nurse who did not handle your father properly. We had a meeting, and she's here in front of you, and
Yeah,
she
please,
said there
please
was a
ask her.
reason.
Na? Yeah, please
She
ask her
had
to
a
explain.
reason.
Na?
she had a reason. She had about 4
Yeah.
patients to be done at the same time. So there were patients, attendants calling her from all sides. So there was, she had to do it quickly. She's
Yeah,
sorry
that means you
about
don't
it.
have enough of adequate staff with you. Only one person is handling 4 people. So is that the problem of the
No,
patient and the
no, it happened.
relative?
It happened at the same time. It happened at the same time.
But then you need to have enough staff. How can that be an excuse that only one person is attending to 4 patients?
It
That
was
means you are
not 1:4.
inadequate with your people
It
and
was
your
not
staff, and your hospital
1:4.
is, not providing enough of manpower in
But
the
sir,
ward.
when you soil the linen, when you soil it, it is not that the same. You don't know who's going to do it at what time.
Yeah, but
So it
then,
did
but you
happen at the
need,
same time, and there was
yeah,
a problem.
you need to have more people
Okay, and
to
she's
attend
saying
to the
sorry about
patients.
it. And she's saying
Yeah,
sorry.
but
She's
just
sorry
merely
about
saying
it.
sorry, it doesn't
It
make
will
any
not be
sense.
repeated again.
But it
She's here in
doesn't make
front of
any
you.
sense. How can it be undone then? You need to provide enough of manpower in your hospital rather than having only one person looking at 4 patients.
Sir,
Am I right?
Sir, it was not one patient. It happened at the same time when 4
Yeah, it could
people
happen for the same time. I don't say
soiled the
no.
clothes at the same
Just
time.
Let
saying
her,
sorry,
let her
but
apologize.
why don't
Let
you
her
provide?
apologize.
It took some time, but yes, she said she's sorry about it, and she said she's sorry about it. She's
Yeah,
saying
but
No,
can
sorry
you
to
do
you
some
about it.
we are
corrections?
going to call the media. We are going to call the media.
Yes, yes.
Sir,
We're
it
going
is
to
just a
highlight
question
it.
of soiled linen. I
Yes,
don't think we need to have a media. I'm sorry about it. And she's also sorry. She said the person who has done it has said sorry about it.
but that's what I said. Now, what corrective actions are you going to take about this?
And in
That
future,
it
we'll
won't
see.
happen further.
It will not happen again. I can assure you that in future we will have
No,
more staff there present.
Yes, the problem is that one of the
And they will
attendees we have
and
seen
we'll
it.
train them. We'll give them training so that they
This
are
is
not
the
rude.
standard of the quality of the care which you are providing to the patient. Fortunately, one of the attendees have seen it. That's what it came to the limelight.
So I can
So you
assure
are
you.
ill-treating the patient. You are ill-treating the patient. That's what the concern of us. Just
Sir, I can
because one
assure
attendee
you
was
that
there, just because
they'll
one
be
attendee was there,
trained
we
how
have
to
witnessed
talk to
it.
people.
Otherwise,
They will be
And the
trained
patient is
how to
getting
talk
into
to people.
more of suffering than of being cured. This is a way to behave with the patient. The patient is getting more stressed.
Sir, we'll take
He
a
will get,
training for them on that, and I'm assure you it will not happen again. They will be trained how to talk to people, how to change the clothes, not to be rude. We will have a special training for such people. Since you've already pointed one person, yes, we will check
so
out
you're
when we can
saying
have the
you
training.
don't train your nurses before appointing them.
We train the people, but you need to reassure them. You have to go on retraining them. That's
yeah, but
very important.
what about providing adequate manpower in the ward apart from one attendant?
Providing adequate manpower and training. It will go side by side because we need to train them. Suppose we have got lots of manpower and they don't know how to talk to people. That is not right. So we need to train them of how to talk to people.
Please counsel your staff.
Sorry, Jenna, to have put you at that spot. How did it feel being there, Jenna?
Doctor, I face this every day. Not with the patients, with the staff. I'm having this problem with the doctors, with everybody, almost every day. There's not a single day like there's nothing like this. Especially the doctors, especially the young doctors.
Ma'am, just to add, out of context, today I have dealt with a scenario. I'm just concluding with one minute. I had a emergency call from General Hospital in our district. There was an intrauterine death post emergency CS. Whole media, whole persons, patients' relatives, all were there. I was sent by the district administration to assess and apprise the situation. I was there. So almost some kind of this crowd, media, police, some kind of 50-40 people coming outside operation theater, labor room. I was explaining to them. All these things happened just some 6 hours back. Thanks to you, ma'am. Some of your tips helped me. So I have to just say that.
Thank you. Thank you. It's only, once you become aware how to handle it, you can handle the same thing better. So, Jenna, I want to ask you, what do you think you did effectively? If you reflect on your performance, what do you think you did effectively? I'm not able to hear you, Jenna. I think your device is on mute mode.
Doctor, I think I heard them and I said sorry many times. I think sorry is very important. That's what I felt.
You heard them.
And I said sorry. it will not be repeated again.
Okay. Now I want to ask the family. What do you think Jenna did effectively?
She was hearing us. She was trying to pacify us, and that's the most important thing. She was not impatient. She was trying to explain the scenario. She was even trying to defend the nurse in her staff. She was apologizing for her part and for her action, and she promised that corrective actions will be taken. So I think those things were satisfactory and good, in fact.
Jenna was listening very patiently, although she was getting bombarded, but she was listening very patiently and trying to pacify that corrective actions will be taken. So, well, this was very good on our part to, try and hold the patients in spite of two at a time, bombarding her with, all the questions.
Sure. So I want to ask others who are observing, what do you think Jenna did effectively? Other than what they have already talked, anything new that you want to add as an observation to what Bijoy and Mr. Vijayaraj has spoken? Yes, Anu.
She tried to explain like why it has happened because her sister is busy with other patients also, and she didn't lose her patience and she's listening, and she didn't lose coolness. Like if other person is there, they may be shouted at them, or they would have lost their coolness, or they would have spoken the same tone, but she didn't do that.
She was
Madam,
calm.
So she allowed the patient attenders to vent their anger out.
Okay. She
Madam,
allowed them to. Yes, please.
along with venting, she also gave some
Go ahead.
remedial action in the future, ma'am, that she'll train and she'll get more manpower.
Anything else that you observed other than what on quite calm, collected tone? Okay, Jenna, given a chance, if you were asked to do the same role play once again, anything you will do differently?
Maybe I will listen first to all their problems. Then maybe I would tell them, okay, fine, give me some time. Give me a minute or so that I can go and discuss, check it out properly. Okay, and then come with the answers and tell them it is like this, and then say the same thing, maybe sorry, whatever.
So, in such situations, does justifying help? I want to ask others.
No, it doesn't help because better is
There were 4 patients, so she was rude.
that won't help.
So, I mean, thankfully, the family did not say, you mean if you have more patients, you will be rude and aggressive with my patients. You will misbehave with my patients. So, at that moment, justification, I don't think it will. Second question. Will I ask my staff to come and apologize? Anu, yes?
Doctor, depending on the situation.
Jenna,
Sometimes.
I know, I'm not saying there is no one-line answer, but generally I want to ask you, if you were asked by your senior to come and apologize, will you be okay with that? Will you like that? How will you feel yourself if you were asked by your senior to come and apologize because this minister is very unhappy with you, this IS officer is very unhappy with your staff's behavior, and you are HR, so you have to apologize, or you are doctor in charge, you have to apologize, or you are nurse in charge, you have to apologize. Will you be okay?
No, doctor, but then sometimes we have to do it. We do it sometimes.
I will come to that. I will come to that. But before I agree to getting my staff, I know there are situations where we have to do that. I'm not saying there is no, you should not do it. We do it. But before I agree to that, can I do something to prevent that situation where I bring the patient party and my staff in front of each other, because there's a risk of violence. The staff, the family might become so aggressive that they may start hitting my staff. Forget about apologizing. And how will I handle that situation? And also, before I allow that to happen, see, when my staff goes wrong, I am responsible for that wrong. Being senior is not easy. Higher you go, more responsibility comes on your shoulder. And if your team fails, you fail. If they haven't done well, I can't say my staff is wrong. I have not trained them. It's my responsibility. So I think if I make my staff apologize, one is if I bring them in front of each other, there's a risk of violence. They can become aggressive. Second, where will my staff's confidence, self-respect, and respect for me as a senior go? Ask yourself. I think this is a question I want all of you to reflect. Those are okay with the idea of I know there are situations you have to bring in.
Can
But
I come in?
can I?
Can I come in, Dr.
Sure,
Hindu?
please. Yes.
What I feel is that in this situation, instead of meeting both the parties and apologizing, I think so it would be fair enough for one senior person to go and understand the entire thing and explain the entire situation and tender an apology that there would be definitely a lot of room for improvement and we regret for what has happened, but at the same time assuring that definitely corrective actions will be taken.
Apology is okay. Regret is fine. Corrective action, I think, was done well. Preventive action, we'll train, we will sensitize them. Everything was okay. Bringing the patient staff in front of the patient party is something we have to first try not to let that happen.
Yes, I agree.
That is one point I want to mention. Don't easily give up. Don't immediately agree for it. There is a way to dissuade. I'll talk about it. Maybe I'll do the same role play with you, all of you, to show how to handle in such situation. And also, when you justify that because there were a lot of patients, that is why your patient got neglected or your patient was ill-treated, that is going to aggravate them. Another thing, the family said, I'm going to call media. And if I'm saying it was a small thing that your patient clothes got soiled and my staff was changing and Shiraf handled it, I don't think there is any point in calling media and police into it. Again, I am asking all of you, how far do you agree with this?
No, I don't
And you think
agree.
the patient party will take it?
No, because any disrespect or any mistake done should be accepted, and there should be no reason that we say that this was a small thing.
Again, I have to handle that. See, family will say, Jana, family will definitely say, I'll call police, I'll call media. If I say that there is no point calling up, it's not a big thing that you have to call police. It's a small thing. It happens every day. It happens. We have so many patients. It happens. There is no point. They'll say, who are you to decide whether I should be involving police or not? You have disrespected my patient and his rights. I have patients' rights. I want my patients' rights to be respected. So I'm saying to agree or not to agree, there are ways to tell. So this is something we have to really learn as administrators, as seniors, as handling people. We have to learn how to handle these kind of situations. So same situation, Dr. Bijoy and Dr. Vijay, Mr. Vijay, you be the patient's attendant. I attend as a maybe so maybe nurse in charge, maybe one. Let me the department. Is that okay? Okay. So 2 minutes. I request everyone to switch off your videos, and we three are in the. So I'm assuming that it is ICU, and I'm also in the ICU. I am in charge there, nursing in charge. You can say, or yeah, nursing in charge. You can say, and you both come in, and I see you, and I'm asking you, Bijoy, you are Mr. Ramesh's son, and Mr. Vijayaraj, I think you are also his son. So you have some concerns to talk.
Yes,
Yes.
Dr. Bindu. We have some serious concerns to raise because, as you know, our father is admitted here. So last day he soiled his clothes with his urine, and that sister who was taking care of her was behaving in the most rude manner. We cannot simply accept it. So he
My
was
father
just,
at this age has become very embarrassed. Being a
yes,
patient, it was something which cannot be tolerated. It's like an insult to this old man.
So
I mean,
you
he
were
has to be
personally
cared for.
you were personally present there?
I was
Anyone?
there. I was there. I just witnessed
Okay.
it. I witnessed it, and my father was embarrassed to behave like that. And the
Can
problem
you
is that
can you
no,
please tell me in detail what exactly happened? I want to
no,
understand.
he just soiled his clothes, and the sister was helping him to change the clothes while going to the washroom. So that happened, and while changing the clothes, and sister was behaving in the most rude manner. It's
How
like
can she behave in such a rude manner?
yeah.
This is not the way to behave with a patient. Is it having some sort of stress that the way the nurses behaved this way? And is this the way to behave with a patient? The patient
Fortunately, I
has to be
saw this is an
comforted.
ICU. This is an ICU. Fortunately, I was just passing by and I saw what happened.
Sure. Understand your concern. I'm sure this must be very upsetting to you. So since you have come to me, I'll definitely first of all look into it. Let me talk to my staff and see who was on duty and who you know the person who did
Yeah,
this.
but
You can
yeah,
you recognize?
but the nurse she has to apologize. This is not the way she can behave with my father.
No, it's
Mr.
just that we saw it. We just saw that incident. This is the way which she behaves with each and everyone. This is not acceptable for us. You cannot ill-treat a patient. You
I
simply cannot.
completely understand your concern, Mr. Vijay. Let me speak to my staff. Let me understand. Give me 5 minutes. Let me talk to them, and I come back to you. Is that okay? Give me
Yeah,
five
but
minutes.
what are you going to do with it by
No, I
coming
want you
back?
to. I want you to throw that staff away from ICU. This
Yeah,
kind of staff should not be there behaving, working in a hospital.
I,
In an
I,
ICU setup, in an ICU setup, you are ill-treating a patient because a 75-year-old person will definitely will soil her clothes. She will have
yeah,
some patient.
and he'll be feeling very embarrassed with the kind of
No,
behavior of the nurse.
you
I
are having such
completely
big.
understand your concern. I'm
No,
really sorry
we are
for this.
planning to go online. We are going to put a big poster and
Yeah,
all.
we'll
No,
report to the
we won't
media
leave it.
also.
Yeah, we will
Yeah,
report to the
Give
media.
me
We
let,
cannot
let
leave it.
everybody come to know how your hospital is treating the old patient.
give me few minutes. Mr. Vijay,
I
whatever
want
you
you to
want to
call. No,
do,
no,
I
madam,
want
Dr.
sure.
Bindu, no, it's not acceptable. I want you to
I
call that
can't.
specific sister. I want you to call
I'm
that
telling
specific staff. I want you to. I want her to apologize. If it is not
Please call
possible,
her.
yeah, you call her. You call her. You call. Ask her to apologize in front of us.
Okay. Let me first you finish. I'll listen to you, but when I speak, I request you to have 2 minutes patience to listen to what I want to say. See, I am here to help you. I want to help you. I want to address your concern. I'm apologizing for what happened to your father. It's
No, we
really
won't
not.
accept. We won't accept your apology. We want that staff to
We
be
want
called.
the
Me,
nurse to come and
Yeah.
speak to
No,
us.
your apology won't
absolutely, I
suffice.
understand what you want. Give me few minutes to first of all. I have not spoken to anybody. I need to see what exactly happened. Give me 5 minutes to talk to them, and then I come back to you and I address it as but you will have to give me those few minutes. Please understand. If you have come to me, you have to allow me to take the right steps that I need to take. I have to listen to both the concern. I can see you are very upset, but you have, is that okay?
Yes, you please proceed. You please proceed. But the problem is that
She has to come and apologize.
yes, she has to come and apologize. No, we are not ready for any other compromise. That patient, that sister wants to come and apologize to her father.
Mr. Bijoy and Mr. Vijayaraj, I've spoken to my nurse. I have got to know this is what exactly happened, what you have talked to me, whatever you have shared with me. This is exactly what has happened. I'm going to definitely take action on this. I'm going to make sure that this does not get repeated. you will have to, let me handle it in the way the hospital protocol guides us to handle such incidents. I'm glad that you brought it to my notice. I'm going to take action on this. I'm going to talk to her. I'm going to see what can be done to make sure that this does not happen again. But you will have to give me some time to work on that. And I'm apologizing on her behalf. I know it was not something
Doctor,
that
you haven't done anything. Doctor, the problem is you haven't done anything. Your staff has misbehaved with a sick, ill patient from ICU. So we are requesting, we are asking for an apology from that staff.
Mr. Bijoy. Mr.
Why is the nurse not apologizing? Why are you apologizing, ma'am?
Yes, exactly. That's what our problem is.
Okay. See, I completely understand that you want her to apologize. But at the same time, I want to take your focus to your patient's welfare. Please remember, if I'll ask my staff to apologize, one, they will get discouraged. Second is all other staff will be on caution. They will also be scared of handling your patient. I request you to see the broader picture. We have to see that your patient is looked after and is well attended by everyone. When it comes to taking action, I assure you I will take action. I'll update you what action has been taken. But making her apologize is just going to demoralize her and other staff members also. I request you to consider your patient's welfare. Because I know you're annoyed, you're upset, and it's very, very normal, it's very general, it is very, very honestly, it's anybody in your place. Even had I been in your place, I would have been equally upset. But please remember, our focus should be your patient's welfare. If you will ask me to apologize, if you will ask her to come and she will do. If I'll ask her to do, she'll come and do. But tell me how will it benefit your patient? Your patient requires attention. Also, please remember, when one person is made to apologize, all other staff members also become upset, and they are not in their right frame of mind. And honestly, more errors happen when somebody is disturbed or panicking. This is what is my thought. I assure you, I will take action. I'll speak to her. Whatever has to be done, that protocol will definitely be followed. I'll come back to you with whatever follow-up action we take. And you will see a change in, the way. But please remember, we have to focus on your patient's welfare. I hope that's okay with you. Thank you. Can I request everyone? So even if you had asked me that I'll call media and I'll call police, I would have said this, as a response to this. Mr. Bijoy, I can't stop you from calling police or media. That's your right. I will not stop you. But at the same time, that's not going to help our patient. Please remember, our focus is your patient. We want our patient to not suffer any, consequences of this conflict. So shift the focus to the patients then. So I hope that brings a new thought process to the same situation.
Yes, definitely.
Yes,
any questions about whatever, or any comments or anything anybody wants to say about the role play?
Ma'am, if I may.
Please.
So, madam, it was a very illustrative example which you set for us, that you worked on rationalization, and shifting of focus is a very good tip which we have received, and also the consequences of the apology. What is the purpose of the apology and what are the consequences? Apologizing on the nurse's behalf. All these are the practical tips which we took away from. Very good illustration, ma'am. Thank you.
Thank you. Thank you so much. Thank you. So the whole idea is, see, you have to learn to balance. We can't throw the buck on the staff that you have done wrong, so you face it now. And I can't even argue with the patient party saying that it's a small issue, you are making big issue out of it. For them, it is big, so it is big. You are not able to see that. That's because we see it every day, so we become used to it. But for them, it's something very big. It's very disturbing, very upsetting. Their father has been insulted. Their father has been mishandled. So naturally, they will be annoyed. They will be annoyed. So let me share the PowerPoint presentation short PowerPoint presentation that I have prepared for today's discussion. So first we will discuss what kind of complaints we hear. So this was a interesting article I saw, and then I picked up good points from it, and I'm going to share with you. So you will get to see 6 categories of complaints and requests that you get, 6 broad categories. We'll talk about that shortly. And then couple of steps, if we remember how to handle situation. If you observed, I tried to recognize the patient party. I called them by name. I even asked them, do you have any concern? Kindly said. They insisted, do something, do something. I allowed them to speak, but then I asserted that when you are speaking, I will listen. When I speak, I request you to listen to me. I also did not agree easily to calling my staff. I said, let me speak to my staff. Let me listen to both the parties. I didn't say what you're saying is wrong. Maybe you are mistaken. Maybe you overread it. Maybe, no, I did not say that. I said, what you are saying must be very, genuine on your part. So if you we'll talk about those steps, and most of the situations you can handle if you are able to follow similar steps in your interaction. So let me share the presentation and also take you through the common reasons why people complain. Give me 1 second to share. Yeah. So this was an interesting blog that I saw, so I thought I'll share with all of you that there are 6 broad categories under which we can put all sorts of complaints and requests that come to us. It's taking time to load. Give me. Yeah. So one of the common reasons that you will get to hear complain is about staff behavior and attitude. So they'll always, you'll get to hear that the staff was either rude or disrespectful, or they were not professional, or they did not address patients' concerns, especially if it was pain, fever, shivering, bleeding, or dizziness. So these complaints that patients have, and we don't listen to those complaints promptly. So they feel their patients have not been, attended promptly. Sometimes you'll also get to hear that I was discriminated because of my gender or my religion or my ethnicity. So these kind of complaints you will hear about the staff behavior and attitude. Second complaint that you will often get to hear is about the excess and timeliness of care. So like some of you mentioned that, usually if there's long waiting time for appointment or for some test or procedure or collecting the report, you will see that there will be complaints. Or if there is no coordination between people, especially, for example, in discharge, we say we discharge, but we don't tell to the patient party how much time it is going to take, or even between us, we don't coordinate. We send the file to the billing section or a particular section, and then we don't do follow-up to check why is it taking long or how much is it going to take. So naturally, the patient party is in hurry to go, and there will be, they'll be upset about it. Also, in case if there is some, medical service or equipment not available or, working, you will see there will be complaint about that. Third common category is communication and information, where there is no good, proper communication with the team and the patient party. Or they want some information or procedure or outcome. Sometimes we get the test done, they pay for the test, we get the report, but nobody explains what is the test outcome. So they are very upset. I spent 5,000 rupees, 10,000 rupees, but nobody is telling me what is the result and what is the outcome. Also, sometimes they want to go for second opinion, or they want medical report for some reason, and they don't get the prompt response from us. Again, that becomes a reason for them to be unhappy with us. Another common reason that you will get to hear is about patient safety and environment. So whenever there's any kind of harm that the patient experiences, and we know even by WHO reports, every 1 in 10 patients experience some kind of harm inflicted by us. So you can well imagine, and don't think that they don't know about it. They can sense it. They can see infections the patient gets because of us, injuries the patient gets because of us, pricks that we give, number of pricks because our staff is not very good at IV or cannula. So they can sense that if the patient's health was adversely affected because of us. Or for example, the environment is not safe for the patient. For example, patient fall, and 1 in 100 patients experience fall because of our negligence, either in the bathroom or from the bed, and that also becomes a reason for them to be unhappy with our services. Also, A lot of problems and complaints are about billing and financial issues, especially when they feel that there is some discrepancy or there is excessive charges or that service was not given but we have been charged for it, or there's lack of transparency. If you're giving a broad term and you're just billing lump sum, so they feel that what exactly we mean by this. So all these reasons, can be very upsetting, especially when they feel that they have been overcharged. There will be dissatisfaction. Another common reason you will get to hear a lot of complaint is about medical care, where either there's a delayed diagnosis or the diagnostic error that has happened in patient care. And don't think that diagnostic error is uncommon. Lot of diagnostic errors happen under your nose. Only thing is patients don't get to know, they don't get to realize, but we all know. In US, 37% of the lawsuits are for misdiagnosis, wrong diagnosis. But India patients are not very alert and they don't really try to pursue that. So therefore, we are saved on that front. A lot of time medical errors happen because of the treatment or the surgery that we do, or the patient does not receive adequate or appropriate medical treatment. Medication error, we all know. Lack of informed consent. So all this is about medical care. So these are the common reasons when you will get to hear some complaint. Initially, it will come always to the hospital. And if you honestly don't want any legal action, or if you don't want the person to go to media or to police, if you are able to handle it at stage 1, de-escalating, you can stop the buck here. Problem is when you don't address their concerns and nobody listens to them and nobody answers them properly, nobody handles them properly, that is where they get frustrated. So either they will, but if we are able to stop the buck here and handle it well, you can manage most of the situations right in your system. So this is briefly about the common reasons that you will get to hear complaints about. Now coming to the steps that I thought we should discuss, and that is 1 second. So again, how we handle a situation depends on our communication style and also on our conflict management style. So if our communication style is I'm a passive responder or I'm an aggressive responder, if I'm passive responder, I'm not going to take any action. If I'm aggressive responder, I'm going to find fault with the patient party and argue with them. But the right way of handling any situation is look into the problem and solve it. Only then you can actually provide them a solution and send them satisfied. So coming to these steps, so these are just guidelines. This should give you ideas how you can actually address the situation and de-escalate it. So for example, the first thing that we have to remember when they come into your visual field or when they come to your office or to your desk, first thing is that you give prompt attention and you should show that I want to help you. A lot of time we don't give them attention. I'm busy doing something. I make them wait. I don't acknowledge them. I don't recognize them. I don't know who they are. I'm asking their name. There's no harm asking their name. I'm not saying that you have to know all 100 patients of you, but then that intention that I want to help you has to be seen through your verbal, non-verbal, body language, tone of voice. So once you are able to demonstrate that, that gives them satisfaction that, okay, there is somebody who wants to help us. Then, of course, it's very important to offer them space, safe space to express. So maybe they will start talking to you right at the nurse's station or at the doctor's station, but you can see that they are upset and they are aggressive. So very important is to segregate them from there. It's better to make them sit at one place, take them to the side room or counseling room or whichever area you have where you can peacefully sit and talk to them. So that will give you an opportunity to talk one-on-one with them, and also they will feel that okay, they are ready to address my concern and they are taking it seriously. So make them sit and talk and demonstrate respect and interest that yeah, I'm ready to listen. Second step is communicate and follow the process. It's very important to identify who you are, what your role is, and how you can help them. So if all of us are wearing blue uniform or green uniform or gray uniform, and we don't have any, name tag, nobody will know who is patient care coordinator, who is nurse, who is sister in charge, who is doctor. So you have to tell I'm sister in charge here, or I'm the grievance officer, or I'm the resident in charge here. I'm consultant. Unless they already know you. If they know you, there is no need to again tell who you are. But then in case if you're meeting for the first time, it's helpful to tell them that I'm the grievance officer, I'm the patient care coordinator. I'm here to help you. I will address your problem. So explain the process and procedure in simple way. I will listen to you. I will listen to the other party, and I definitely see how I can help you and minimize the damage. Of course, if you can see them very upset, it's good to promptly acknowledge that I can see you're very upset. You seem very disturbed. I'm sure it must have been very upsetting for you. Saying this itself gives them a feeling that somebody is empathizing with me. Somebody is able to read my emotion. Somebody is aware of what I'm going through. And then in such situation, you can anticipate these kind of questions that are coming to you. So you have to really learn to be ready how you're going to handle those situations. They will not let you talk. They will shout at you. Know that they will do that, and or they may say, "Who you are? Why should I listen to you? Call your doctor. Call your manager. I don't want to talk to you." So know that these things will come your way, and then of course, right from the beginning, you have to assure them that I'm here to help you, but I first need to understand the situation. I need to know what exactly is the problem. I will listen to you. I will listen to my staff, and I'll definitely address your concern. This is step 2. Coming to step 3, now ask them and understand their concern. So if you saw in the role play I played, I asked them, were one of you present there when it happened? Then Bijoy said, yes, I was there. I said, can you explain to me in your words what exactly happened? So when you get to hear from the other person, one is that you now are not assuming anything, you are listening it firsthand. Second is when the other person speaks about the problem, they feel I have been able to tell the problem in my words and somebody is listening to my problem. They feel that I am being heard. So when you demonstrate that through your verbal and non-verbal, communication, they feel that somebody is genuinely trying to understand my concern. And trust me, even that also is very, satisfying to them. Of course, when they are sharing their concern, it is very important to listen to them attentively. At that moment, if you are doing something, or if you're talking to somebody, or if you're looking at watch, or if you're saying that, please write your complaint and leave it here and I'll come back and talk to you, that's not going to be. So the attentive listening skills that we have discussed earlier, you will have to, use them in your gestures and in your verbal and non-verbal communication. Half the suffering diffuses if somebody listens to the problem attentively. And most of them are satisfied even with that point of view. So when you're listening to them, please try to see their perspective. They are saying, my father, 75 years old, he felt embarrassed. He's feeling very ashamed of what exactly happened. Your staff mishandled. Your staff was rude, was using, disrespectful language. Now, to you, it might appear that's nothing very big. Again, if it was my father and if somebody was, rude to my father or was disrespectful, how will I feel? So it is not that the fact, it is also the emotions that is leading to frustration, dissatisfaction. So when you will try to see their perspective, automatically you will be able to empathize with. And then empathy has to be not only recognized and acknowledged, it has to be verbally expressed that, yes, I can see you're very upset. And it's very normal to be upset. Had I been in your place, I'm sure even I would have been upset. So when you are saying something like this, you are in a way communicating, I understand, and I think you are right in how you're feeling. So when you empathize in this manner, they start feeling that my emotions are being understood. And at that moment, make sure that you observe their body language, their demeanor. As we had talked earlier, 93% of the communication is tone of voice and also their body language. But there are two people. You will always see one will be aggressive, the other will be little less aggressive. That will give you a chance who will connect with me, who will understand, who will be on my side, who will align with me. Also from their tone of voice, you can get to know, are they aggressive, are they panicking, are they anxious, are they upset, are they crying? So you will get to read even those aspects of their behavior. At the same time, we have to be mindful of our demeanor. Anywhere, if our body language or our facial expressions indicate that I'm angry, I am upset, I don't agree with you. What you're talking is a very small thing. You're making a big issue of a small thing. it's a very hurtful reaction. It's very painful. So one should be very, very careful about the facial expression and body language that you hold. So when they are talking about their problem, rather than justifying, rather than answering, rather than apologizing, allow them to complete. Allow them to vent out. Allow them to, at that moment, just nodding, just agreeing, just showing that I'm listening to you, will give them that satisfaction that you are giving them a chance to speak. So even if you try to correct them or justify yourself, that's not going to help. That's rather going to upset them, and they're going to counterattack you because of that. Very important here is to mind your words. So saying something like this, it's not a big thing, it's a small thing. It's not, going to help in any way. So what can I do? That's not my problem. I can't, it's not a big deal. Why are you making it? This happens every day. See, when there are a lot of patients, something like this can happen. It's not a big issue. So what you are trying to say that you are making a big issue of small thing. That's something not desirable. Again, some actions that can aggravate this situation. For example, if I say, what do I do about it? I'm not responsible for it. Or if you try to kind of, become aggressive with them and show them big eyes and disinterest, that can also, aggravate this situation. Apologize. I think, do we all agree that we should apologize or no?
Yes, we should apologize.
And are we okay with apologizing? Do
If
we
the
apologize?
mistake is done, we should apologize.
So, Ravinder, a lot of time, for example, patient came for MRI. After waiting for 2 or 3 hours for their turn, suddenly the machine broke. Now the patient has undergone a lot of inconvenience. So when they come to you, what is this? We are here since 9 o'clock, it's 12 o'clock. Now your staff is saying the machine is not working. This is very unfair. My mother is unwell. She's, waiting in the lobby. So see, this is an inconvenience that has happened to them. So a lot of time, even if there is no mistake, when you apologize for the inconvenience, even that gives them satisfaction that we understand their pain. So this apology is not that I have, damaged the machine or I have made the machine to go out of order, but it is the apology for inconvenience. So actually, I am sorry has two meanings. One is expression of compassion. So when you say, I'm sorry that this happened with you, or you had to go through this. So it's more of an expression of compassion. And when actually something has gone wrong, and if my staff is misbehaved, and then when I say I'm sorry for my staff's behavior, it is the expression of responsibility. So the first one is always appropriate. The moment you say, I'm sorry you had to go through this, I'm sorry for the inconvenience. So they get to feel that you understand their pain, their suffering. The second one, when you take responsibility, even there they feel that at least you are taking the responsibility for your staff's behavior. A lot of time, apology fails, especially when my apology is more like a verbal apology and not the intention. For example, if what you are saying is true, I think I should say sorry. So that means I'm not sure if you're telling truth. Or there was a mistake, but there were so many patients, so this happened. That apology will not help. I'm sorry, we can't attend to your individual request. Again, that apology has no sense. Sometimes these things happen when there is lot of workload. So, please pardon me. Again, that's not an apology, and that does not help me. So once you have kind of come to a point where you know that their concern is very genuine, it's important to reassure of prompt action. So you really need to tell them that I want to help you, I'm here to help you, and let me understand the situation and see how I can help you. So make all efforts to reduce the suffering and minimize the damage. Suppose if the patient has suffered some injury because of my staff, so I'll say, I think I'll come and discuss this, but let me first see how we can, look after your patient. And if they say my patient is, waiting outside in lobby for the last 3 hours, so you say, is she feeling okay? Is she all right? Does she need a bed to rest? Does she want to lie down? So what you're trying to see, you're making the patient comfortable. So you're shifting their focus to the fact that more than anything else, your patient's welfare is very important to me. And when you are able to bring their focus to the patient's welfare, even they feel calm and feel being attended. So when you are exploring alternatives, normally we offer solutions. It's a good way to ask what do they want. So when you ask them what do you want, then you get to know what exactly they are looking for. So for example, in this case, they said we want apology. I said, let me speak to my staff, let me get the facts, I'll come back to you. I come back to them and they say, yes, we want apology. Now I know that they want apology. I have to address that and I see how I can, prevent that from happening. So when you are, trying to find out a solution, rather than focusing on their behavior, why are you talking like this? You can't behave like this. You can't be rude to me. My staff is misbehaved with me. Why are you rude with me? So I can't focus on their behavior. I have to focus on the solution, and I know this time they are going to, be aggressive and they are angry with the whole system. So I'm the one who is handling it. So in such situation, being defensive is not something desired. Don't try to defend your staff. Don't try to justify. Don't try to give reason. It's better to accept that yes, this happened. Let's see what best can be done to save the patient. While exploring alternative, or explore alternatives with an open mind. You really will have to go, thinking what can be done to resolve the situation. So I want you to draw these 9 dots in your notebook. Done? I'm going to stop sharing. So draw those 9 dots in your notebook and connect these 9 dots with 4 straight lines without lifting your pen. Connect these 9 dots with 4 straight lines without lifting your pen. Could anybody do it? Take a minute. Try a couple of times. A study by Harvard says every problem has minimum 4 solutions. Could anybody do it? Dr. Som, are you there? Could you do it? Let's see. Because of your virtual background, we are not able to see, but yes, you have been able to do it. Yes, Dr. Bijoy, Dr. Som, I could see yours. Thank you. Dr. Bijoy, could you do it? Dr. Bijoy, no, you could not do it. Anybody else who could do it? No. Okay, let me show you the. I had requested you to connect these 9 dots with 4 straight lines. Somebody's device is on. Can I request you to mute your device? Thank you. So the idea is you need to go out of the box to find solution. You were trying to find the solution within the box. There's another solution. If I told you that these 9 dots can be connected with 3 lines, will you trust me? So what I'm trying to communicate or bring home the message is, we need to think out of the box, find solution. So when you're looking for alternatives, you'll have to really be, good at finding solutions that create win-win situation for you and for the patient party. So old ways of handling these situations will not help. They will not work. Being adamant, being rigid, being aggressive will not help. So we have to go really out of the box to see what my patient wants and what I can do. So explore alternatives, keeping in the larger interest in mind. There can be patient party who said that I'm going to call media, and they might call media if they are dissatisfied. So I have to keep in mind which side the ball is rolling, and accordingly I have to see what can be done in the best situation. We have to be mindful of the consequences. Sometimes being rigid can be very, very disastrous. So we have to be flexible. So whatever negotiation you do with the patient party or with anybody for that matter, you have to do it confidently. You should know what you can do and what is not doable, that also should be communicated in a very clear but respectful manner. So in case something is not in your authority, for example, they ask for some financial benefit. You can't do that. But you can always escalate it to the higher ups for appropriate action. In a very respectful manner, you can say, I'm sorry, this is not in my authority, but I can definitely put it to my higher ups. I can request them to take a compassionate stand. That means I'm with you. I want to help you. I can't help it because it's not in my authority. And I'll forward it to my seniors. That's all. And genuinely try to forward their concern. Now, very important step here is when you're negotiating with them, please know your own hot buttons, your own issues. A lot of time when we get upset, we are overwhelmed, we also overreact to the situation. We ignore our feelings, we try to suppress our feeling, we suppress our anger, then it can burst out. It can actually come out as an aggressive reaction. We can even start arguing or fighting. But if you're really very upset and you think you're going to really, go out of control, it's better to let someone else help it with a fresh mind. A lot of time when the other person comes in, they're calmer in this your state of mind. They're able to handle it better. I hope you know this stop loss button. Stop loss button. So those who are in investment, they will be knowing this. So when you buy some shares and you tell your agent or your contact person that I'm buying it for 100 rupees, if in case the value goes down, if it goes down, the moment it goes to 90, I request you to sell my shares without asking me. So that means you have drawn a line that this is the stop loss button. Same way when we are doing something like this, if you feel you're not able to handle, if you feel that you are overwhelmed, you are not able to find a solution, draw a line, because then things can go downside and it can have serious consequences. Once everything has been done, discussed, found out, solved, make sure that you document that incident. Writing about what exactly happened, how they defined the problem, how you responded, what options were described, what you promised, what you agreed. Also, if you think if there is some observation, additional observation or suggestion you want to add, you can add in that. And then, of course, your name and your contact details so that they know who attended to the problem. So the whole idea is once we have documented this, we learn from it at least to minimize things like this happening again. Reflecting is one of the good ways to improve your performance for future, and also learn what other ways do I have to handle it. So make sure that you sit back to first of all check in how you felt during the whole process and how you're feeling now. Discuss with your team, because when you discuss with others and understand from them and ask them how would you handle if you were there in my position, you'll get new ideas of how others are handling or how they would handle. Reading relevant material also gives us ideas about how things can be managed. Learning about conflict management, communication, persuasion, negotiation. These are very important skills. These are very, very important skills. I think each one of us should know about these skills because we have to do this day in, day out. And of course, taking training programs where you upskill yourself and your team to handle such kind of communication is very important. Thank you. So this is briefly about how do you go about handling and resolving situation. I think more than anything, the message that I want you to have is we have to address it. We don't have to ignore or pass the buck to somebody else. If you address it, you can actually nip it right in the bud. That's the thing I feel each one of us should take responsibility. And usually in a large system, there's a diffusion of responsibility. Oh, it's not my duty, it's their duty. They will manage, they will look. And things go out of hand sometimes, and there are aggressive reactions and violence. Any additional points if somebody wants to add, contribute?
I have one thing. It's a couple of times when I have faced some complaints from patients when I visit them for post-operative rounds or something. Then the next day, I always make sure to check out or follow up on the patient whether the complaint has been resolved and how they are feeling about it. And that makes a very good difference because many times the patients, when they're getting discharged, they always say that I escalated a complaint to the doctor, and the doctor made sure that the complaint has been rectified, and he made sure that he followed it up. That's how I came to know that he has corrected it and he's following it up so that the staff nurses or technicians are doing it correctly. So they are assured that a system is in place. So if something goes wrong or some complaint is being escalated, that will be definitely taken care rather than someone giving a lip service that I'll take care of it and then forget about it.
Oh, I really appreciate this point, and I'll add this to the list. So that will be an additional step I will add to the steps, that follow up with the patient party about the resolving of problem. And also probably I would say that in case if you were supposed to take some action, and if you provide them the kind of feedback that this action has been taken and we have taken a cop out, even that would give, for example, if they're complaining at the time of discharge, so they're already gone. But if you are able to communicate to them that this complaint has been resolved by taking this action, even that would be helpful. I will make sure that I add this point in the steps. Thank you so much for adding this. Thank you.
We have a system where if patients have
Sorry.
I'm audible. Yeah. So we have a system when after spinal anesthesia, if patients have got headache and the patients are all discharged, they are back home. We have a pain team, acute pain services team. The nurse who's in charge of the pain team will follow up for next 1 week to find out how the patient is doing. So the next time when the patient visits the surgeon, they will give a feedback that we got a follow-up call for the headache that we have had. It resolved, and then we are happy that we are being taken care of even after we have been discharged.
I'm sure your patient must be really very happy. That's very nice. Thank you. Thank you for sharing that you could, so meticulously make sure that your patient is followed up and they are satisfied with. Hi, young Bijoy. How are you? That's okay. That's okay. Let him be there. How are you?
Learning communication skills from early on, Junior Vijay.
Yes. That's true. That's true. Any other comment or any point somebody wants to add or share to whatever discussion we have had?
Madam, thank you. May I just sum up the ABCDEs? And now F also Dr. Som has given. So
Absolutely.
you told us that A for access, availability, and attitude, B for behavior, C for communication, and for a civil attitude, D for documentation, E for empathy and effectiveness. And these were the ABCDEs which I tried to follow throughout my career. I had made it for myself this mnemonic. And F is now follow up. G is gratitude to you, ma'am.
Oh, thank you so much.
Excellent,
Thank you.
excellent.
I think you have really summed up in a
Excellent.
wonderful way. Excellent.
It's a very
Dr.
good compliment.
At summarizing things. Wow. Thank you. Thank you. So I picked up this topic for the program because I think these are the situations we all face. And we must know how to handle them in a more professional and responsible way. The whole idea is to minimize the damage to the patient and to ourselves. And if each one of us learn to handle these things, at least some problems will be lesser, at least if not all, isn't it? Thank you. Thank you, Dr. Purnima, for summing up. So I think with this, we come to the end of the discussion about the topic. And now we have 3 presentations. Who would go first? Dr. Abhishek, and then Simil, and then Dr. Soma. Okay. So I am just going to change the settings so that Dr. Abhishek, you can share your screen. So please go ahead and start your presentation and discussion.
Is my screen visible?
It came up. Of course, we can see it, but it is fixed on Zoom. Yeah.
Is it?
Yes,
Is it?
Yes. Yeah.
Good evening, everyone. As you can see, my topic is experience sharing. And I would quickly like to begin by sharing my experience about this course, which has made me confront my own bias and my problem areas. So quickly, 2 things. Firstly, it made me look into the way I was treating my staff, and which was not very pleasant many a times. And secondly, it has helped me confront my anxiety, which is something which I lived with all my life. So even sharing this presentation is an extremely anxiety-inducing process, but yes, I'm flowing through it. So having said that, if with Dr. Indu ma'am's permission, if you all can also share a couple of the things that you have navigated and you have confronted through this course, either in the chat box or in the WhatsApp group, that will be great. So having said that, what is experience sharing? It refers to the act of individuals conveying their personal experiences, insights, lessons, and observation to others, often with the intention of imparting knowledge and understanding. It serves as a powerful tool for fostering empathy and growth. What are the advantages of experience sharing? It helps in building bridges of understanding, especially people from different backgrounds, cultural backgrounds, and walks of life. So this helps us to humanize complex issues and allows us to see beyond stereotypes and biases. Secondly, it helps in fostering personal growth and resilience. It helps in amplifying voices and driving change, especially social and political changes. It can help in that. Connecting professionals and fostering innovation. So professionals who openly discuss their successes, failures, challenges can help in contributing to building a culture of continuous learning and improvement. Helps in nurturing empathy and compassion, providing a sense of belonging and validation, which is something we all want to feel. In conflict resolution, so by sharing your experiences, you can help in mutual understanding and facilitate reconciliation. Helps in allowing knowledge transfer, and of course communication skills. So many a times experience sharing needs storytelling, active listening, and articulating thoughts, and thus this helps in um, enhancing communication skills. Now, what are some of the disadvantages? Biased perspectives. So individuals can share their experiences through a biased lens, leading to a limited or skewed understanding of a situation or topic. This can stem from their personal beliefs and cultural background or past experiences, which need not apply to the rest of the audience. Misinterpretation and miscommunication. So the message conveyed through the experience can be misinterpreted. If it is done on a public platform, it can be misinterpreted and leading to confusion or misinformation. Thirdly, overgeneralization. People often tend to generalize their experiences, which again, it need not be true for every one of us. Confirmation bias is the fourth one. What this means is individuals can selectively choose to share their experience, which is in confirming their own pre-existing beliefs or biases rather than challenging them. So this leads to things like echo chambers, where diverse perspectives are disregarded and hindering open-mindedness. Privacy concern is a major thing. If you're sharing an experience in a public or semi-public setting, especially if it's sensitive or confidential information, this can lead to breaches of trust, reputational damage, or even legal repercussions. Emotional impact, this is especially concerning some traumatic experience sharing. So this has to be done with a lot of tact, and this can it can not just the audience, sometimes it can affect the person who's talking about it. Dependency on anecdotal evidence. So just relying on anecdotal evidence may overlook empirical data or scientific research. Now, where can experience sharing be used? In professional and for professional development, such as in various workshops and training programs, conferences, seminars, mentorship programs, where mentors can talk to the mentees about their own experiences. Onboarding processes, where experienced employees can share their experience with the new hires. Personal growth and learning, informal discussions and networking. This I sometimes use with my patients when I talk to them about my own journey with anxiety, which opens them up to talking about their problems. Secondly, during self-reflection and journaling. And thirdly, during support groups and therapy. In education also, it can be used, especially in classroom settings, where educators can use this method to make lessons more engaging. In experiential learning, where students can share their experience and learn from each other, and even field trips and internships. Also in community and social impact, where in volunteer work, especially in activism and advocacy and online platforms and social media, also this experience sharing can be used. Now, quickly, some of the do's of experience sharing is: be authentic, provide context for what you're saying, especially some background information will be helpful. Focus on the learning points for what are you sharing this. Encourage dialogue once you have shared. Respect confidentiality if it's something sensitive information. Be empathetic. Be concise and clear. Use examples wherever needed. Be open-minded for differing viewpoints and reflect on feedback. Then the don'ts are: do not exaggerate or fabricate, because this will undermine your credibility and trustworthiness. Do not blame others in your experience. Disregard diversity, because what has happened to you may not have happened to others. Do not dominate the conversation. be judgmental in your experience sharing. So maintain an attitude of empathy and understanding. Violate privacy, again very important. Do not give too much details. So do not be very wordy. Dismiss feedback. So always be open to feedback. Again, don't lose sight of objectives because you just sharing the experience and why did you even start that in the first place. And ignore emotional impact, especially if it's some traumatic experience that you're sharing. It will be good to begin with some trigger warnings. So the takeaways from this is experience sharing is a great opportunity for learning and growth, and it always contributes to community building and social change. Thank you.
Thank you, Dr. Abhishek. I think it was a wonderful,
Excellent.
excellent share, excellent presentation. I think very to the point and very well explained. Could you please stop sharing your screen?
Yes, ma'am. Yes. Thank you.
Excellent presentation, Dr. Abhishek. I think you were unnecessary being anxious and worried that you will not be, able to do well, but you covered everything in a very beautiful way. I want share their learning or if they have any questions to Dr. Abhishek. Yes, Dr. Purni.
First of all, congratulations, doctor. You did very well. And we can say that anxiety is a great motivator. We can reframe. We can do that. We can change the narrative. Most of the things which are concerns with storytelling. Now, I will just offer my humble suggestion that this experience sharing will merge it with icebreaker. It can be an excellent icebreaker when you start a session, I feel, with the audience, because that's a very good icebreaker which is used, and it helps to bring the group together. And the don'ts which you have told are so very relevant, that no exaggeration, fabrication, and no disrespect of privacy. And what I really appreciated is that the first that you give a trigger warning, because that is very relevant in today's day. That you don't know which part of the audience may be triggered by any experience, because they may identify with it. So I think anxiety rocks. Thank you.
Thank you so much. You're very kind. Thank you.
If anybody has a question for Dr. Abhishek. Wonderful. So, Dr. Abhishek, please don't forget to forward your PPT and your document in the group. Let everybody go, because I think listening here is different, and then reading and then revising it will help them to.
That is excellent.
Yeah.
That's an excellent suggestion.
Yeah, we are asking everyone to post their presentation and also the document so that you can revisit the content. And I think experience sharing is one of the best ways to connect with your audience. And you must have observed that I normally try to bring that in most of the sessions so that we all open up. Okay, and even your vulnerabilities when you share with others, people feel that okay, we are all human being after all. Nobody is perfect, and we all have such similar challenges in life. Thank you for also admitting that you feel anxious about it, and which is very natural and okay. More you will do, more comfortable. Thank you. So who goes next? Simil? Stopped. Sorry.
Dr. Indu, just want to interrupt you. I'm
Yes,
leaving
please.
I'm leaving it because I've got an emergency to attend. Kindly excuse me. Thank you.
Sure. You can watch the part of the video.
Yeah.
Sure.
Thank you. Thank you, everyone.
Thank you. Yes, Simil, go ahead, please.
Mom, is it visible, my slide?
No, you haven't yet shared your screen. You will have to first share your screen.
Share I have.
Yeah, at the bottom there is screen share, no?
That I
Green
was doing.
color.
Yes, I was doing it.
Not yet. Yes.
I hope it is visible.
Yes, it is. No. So I think you can take it to slideshow.
So good evening, everyone. Thank you, Dr. Indu Arneja, for the opportunity. So welcome to the session. So when we are asked to take a session on something, even whether it is for the group of students or it is for a group of patients or for a group of participants in a workshop, we have to keep the learning objectives in mind. And there are many teaching learning methods, and each method has its advantages as well as disadvantages. But we have to decide what you are going to teach. If you have to teach a skill, what method you will be selecting? You can write in the comment box. So for teaching a skill, you can select, you can use either demonstration or simulation. So what is demonstration? Demonstration is a process of teaching someone how to make the things or how to do a task. The basic principle behind demonstration is learning by seeing or doing it. Demonstration can be given to individuals or groups. What are the principles behind demonstration? The task should be useful. The task should be suitable for the demonstration. Everything cannot be taught by demonstration. It should be feasible. There should be enough space available and the equipment should be available. The teacher must be an expert. The teacher should be thorough with the topic as well as the steps of doing it. It should be well planned. If you're asked to take a session, just to give a session in lecture method, maybe you can prepare in 1 hour and can take the session. But if you have to demonstrate, it takes time and need lot of practice. Active participation of the participants. It is not one-way process. After demonstration, you should allow the students or the participant to practice it independently. Encourage to ask questions and take feedback. Consider students' individual needs also. So some students may be visual learners. They will learn more by seeing the things, and others may be auditory learners. They will be benefited by hearing it. So every step should be explained while you are demonstrating. So there are some steps should be followed for an effective demonstration. Step 1 is careful planning and practice. So as I told, you cannot do demonstration at once. It needs a lot of preparation and planning. For that, you should know the audience. Who are your audience? What are their background? What is the previous knowledge of the group? Whether they professionals or laymen. So prepare a lesson plan. Lesson plan should be, you may, before the demonstration, you may have to give a theoretical explanation, or you may have to give an explanation of the subject matter related to. So a lesson plan has to be prepared by keeping the objectives in mind. Keep the demonstration simple. The people will be able to retrieve as well as apply daily wherever they want. If it is simple only, it is possible. If you make it very complicated, it will be difficult to comprehend. Keep the demo between 15 to 30 minutes. And if it is for public, you may keep even short, maybe 5 to 10 minutes. Prepare materials and articles required. Decide and prepare the venue. Use technology purposefully. Use it if it is needed. You may use a video or may use a PowerPoint presentation in order to just to support your demonstration. Practice, practice, practice. That means without practice, it is not possible. If you want to make the demonstration effective, you have to practice again and again. May ask colleagues or mentors to observe. If you are not feeling confident, you can ask some of your colleagues or mentors to observe you and give them feedback. Otherwise, you can videotape your practice and you can see which all area you need to improve. Step 2 of demonstration procedure. Now, after the planning and all, now the session is almost beginning. To introduce the session, you have to ensure that the session is introduced in such a way that the people will get attracted to it. It can be done with the help of a problem, or you may start with a story, or you may ask some questions, or you may assess the previous knowledge. So there are different methods according to the type of topic you can introduce. So that, however it is, the introduction should be attractive and people should be able to elicit attention. Step 2 is presentation of the subject matter. As I have already mentioned, demonstration, before the demonstration, you may have to give some theoretical knowledge or subject matter explanation, depend upon the topic. Difficult, maybe you may have to explain the difficult terminologies or some new terms or some scientific principles behind may need to be explained before starting the demonstration. Step 4 is the actual demonstration. The skill which you are going to teach, you will be demonstrating step by step. It should be clear, simple, and well organized. The teacher must be active and confident. So the teacher, that is the reason it was told, teacher should practice it before doing the demonstration. Make it brief. Don't do the demonstration a long session. It is always better to have brief, simple sessions. Use clear and simple language. Give attention to all the participants. And teaching aids you may use in between the presentation. You may use models, blackboard, or graphs. That you use only to support your teaching. So your concentration should be on demonstration. For example, PowerPoint can be used to ask questions or to say some scenarios or some problems. Blackboard also may you use to write some important facts or calculations or to write some difficult terminology. And step 5 is guide and monitor. Now the demonstration is over. Your demonstration is over. Now you should give opportunity for the participant to practice it. Step 6 is review. Summarize and highlight the main points. Answer any questions. You can ask if you have any doubts, please clarify. Step 7 is evaluation. You have to evaluate how was the session, whether the session has improved the skill or any modification is needed. You can ask the participant to have a written demonstration or you can take feedbacks. You need to identify the strength and limitations. Then only you'll be able to modify if it is needed. Setting goals and action plans for the future demonstrations, depending upon the feedback and the evaluation. What are the merits of demonstration? Demonstration is a systematic process to teach the skill. It is mainly used for teaching skill only. It activates several senses. You are seeing as well as you are talking, and you may be using visual aids. At the same time, many sense organs are stimulated. That will help in effective learning. Complex skills become more understandable. It will help to correlate the theory and the practice. Demerits include you need experts. People who are confident and expert and thorough about the procedure only should do the demonstrations. It is suitable to small groups only. It is not suitable for all the topics. need time to prepare and increase teachers' workload. Thank you so much. Thank you for listening.
Thank you, Simi. Can you please stop sharing your presentation? Oh, sorry, your screen. Thank you, Simil. I think you made a very elaborate presentation on the topic of demonstration. And I'm
Thank you.
sure you are using this technique a lot with your student nurses and helping them learn a lot of nursing skills. So you picked up a very apt topic for your presentation.
Thank you, ma'am.
You did very well. Yeah. Thank you. Thank you. Any questions for Simil? If anybody wants to say something, some feedback, some additional points.
A good demonstration of a talk on demonstration. Thank you.
Thank you. Thank you, Simil. So the last presentation of the day by Dr. So could you please, and make sure, Simil, that you share your content and your PPT in the... Yes, Dr. Som, please go ahead. Yes.
Yeah, is my screen visible?
But it's not coming in the center. If this is how, I don't know if you want to really show it this way or make it full page.
Just a second.
You have to expand it, no?
Is it full screen now?
Yes, yes.
Yeah, so Dr. Abhishek, don't worry, I'm much more anxious than you. It's just that I don't show it on my face. So, yeah. So before going to my talk proper, I request every one of you to mute yourselves. And we are going to have a small activity for 2 minutes. I request you to sit comfortably with your spine straight and relaxed. Please keep your head straight, chest open, feet flat on the floor. Close your eyes. And when you are ready, you can start this activity. Please follow the instructions that I'm saying and what to tell you, and then try following it. So gently start rubbing 2 fingers, the 2 fingertips, gently against each other with such a tension that you can feel the fingertips ridges on both the fingers. As you're rubbing both the fingertips, you should be able to feel the fingertips, the ridges or the fingerprints. You should be able to feel both the ridges on the fingertips.
Dr. Som, your audio quality is not very clear. I'm not sure
Okay,
if it
I'll be more louder then. Is it better?
Yeah, it's good. It's good.
Okay, fine. Yeah. So please rub your 2 fingertips gently with each other with such a tension that you can feel the ridges on both the fingers. Please start rubbing fingertips of one hand gently against the fingertips of the other hand. And as you start rubbing, please realize that you are able to feel each and every ridge one by one. Please rub it with such a tension that you are able to feel the ridges on both the fingertips, and oppose your hands so that you are able to feel all the ridges on your fingertips, palms of each other hand, and notice all the sensations. as you are feeling the sensations of all the ridges on both the hands rubbing each other, gently keep your right hand over your stomach and notice the rise of the stomach and falling of the stomach with each breath. Just as you're observing the rising and falling of stomach with each breath, also notice the temperature of the air that enters your nostril as well as the temperature of the air that exits your nostrils. Let go of any thoughts when you're breathing. It's absolutely normal to have a flight of ideas or thoughts coming into your mind. And again, put your hands on the stomach and know how it rises with each breath. Take in some nice deep breath and relax. Take your time, and whenever you are ready, you can open your eyes. Thank you everyone for participating in this activity. So in the chat, I would request you to reflect on the activity. So I have only one question. There are a number of questions that can be asked for reflection on this activity. I request you to type in this in the chat box. How did you feel while doing this activity? What are your feelings or what are your thoughts on doing while you were doing this activity? So please type in the chat box about the. I would like to have a reflection on this activity. So reflective questioning is something where we can extract our past as well as engage our future. So this reflective questioning came to my mind when I was reading the book, The 7 Habits of Highly Effective People by the well-known author Stephen Covey. In his second chapter, he asks this question: if I attend my funeral 3 years from now, what do I realistically hope people I care about will say of me then? It was a shock moment for me when I was thinking about it some 7-8 years ago when I was reading this book. It was a shock to me because I have never thought about my death and what people will talk about me during my funeral. I was really baffled, and then that set on a lot of motion of my thoughts, and then that helped me change a lot better for myself. So the reflective questioning helps us to focus in the midst of chaos. So these are the questions that focuses on a person's own experiences with specific concepts or processes. So whenever we have some specific concepts or processes, when we ask questions that focuses on them, it helps us to know much more about ourselves. It's an opportunity to explore the knowledge, experience, and ideas. So we get sometimes thought-provoking, sometimes shocking answers, and these are very personal responses. Since these are very personal responses, there is no one definite answer to the particular question. So just as with this activity, we will be having different answers to all the same question I have asked you. So since these are all personal responses, it helps us to develop ourselves, our personality in a much better way. So it allows us to have some self-reflection, and therefore metacognition will definitely take place. Metacognition is nothing but the awareness as well as understanding of one's own thought process. It's about thinking about our own thinking. It's a wonderful tool. When done properly, it will take us to new heights every time we do this. So where can we use this reflective questioning? So it can be used in any settings where the facilitators would like to understand to learners. If, for example, I'm a teacher, so I teach some concept to a couple of my students or learners. And then once my talk is over about that topic, I can ask reflective questioning. How did that go well? So what was your idea and before this lecture, and what was your idea about this topic after this lecture? So this helps me understanding what they have understood. So If there are any discrepancies or deficiencies, I may take up remedial classes for them. Or if I feel that nothing has entered their brain, then probably it's my fault that I have to change my facilitation techniques and I have to improve upon myself so that I can teach that or I can facilitate that topic much better to my learners. It's helpful in coaching and mentoring. So there are lots of coaches in different areas of life. You have a personal coach, financial coach, life coach, and so on. So when someone mentors someone, and if the coach asks truly important reflective questions, it will help both the mentor as well as the mentee, the coach as well as the coachee, to improve the mentee a much better way. In clinical practice for doctors, it's very, very useful to explain the treatment options. For example, diabetics. So if they are more binging on lots of sweets, so we can ask them some reflective questions like, how did that go well? Or if you're taking lots of sweets and when you see the sugar the next day morning, fasting sugar, how do you feel? So what action you can take upon that? So such sort of reflective question will make them go back to their behavior and helps them in correcting their behavior for their health benefits. It's very, very useful tool in counseling psychology. There are lots of counseling psychology techniques or reflective questions which have helped or which will help those in need of counseling to have a better life, to have better mental health. And preoperative workup, it helps me as an anesthetist to ask reflective questions. So if I explain a couple of treatment options or pain management strategies, and if I ask them to reflect upon if this will be beneficial to you, how do you feel like your leg is not moving completely after surgery? Or how do you feel you wake up groggy? Then it will help an understanding for me to devise an anesthetic plan for my patients. And more importantly, a palliative care, we can ask the questions such as, what is that they want, whether they want to have an all treatment options to be utilized for them to make them alive, or to make their quality of life much better way by giving them pain relief or a palliative care at the end of life care. So at a personal level, it helps in understanding oneself. It helps to recognize one's strength as well as weaknesses. It also helps in interpersonal conflict resolution, and ultimately it leads to the growth and success of an individual as a whole. So in short, we can use this reflective questioning by bringing in a pause so that peace and productivity can be brought upon. So it helps in educating others as well as educating own by self-reflection. So what are the advantages and disadvantages of reflective questioning? The advantages are very good because it's a deliberate way of learning from experiences. So it helps in identifying skills and strengths of one's own. Also, it helps me, if I self-reflect upon myself, it helps in understanding the areas of change and the improvement that I have to do. It also gives an options for future success or to learn from past mistakes. And I can plan with my coach or mentor so that after the observations of the coach and my actions and reflection upon my actions by me as well as by coach and feedback from my coach, I can devise a plan so that I can take it forward how I am going to work on myself. And if I ask questions, it will be more probably I will be more open-ended with myself as a part of self-reflection. I will be non-judgmental, and I will encourage my self-learning or self-directed learning, and I will improve my problem-solving capabilities. What are the disadvantages of reflective questioning? It is I think that it is I need to critically view myself through a lens. So for many people, it may not be very easy to look critically upon one's own self. So it's a learning curve is needed. And I may not be able to tolerate the cognitive load the answers to the reflective questioning brings upon me. So simple reflection is easy. So why did I become angry upon my colleague? So probably that could be an start with. If I reflect simply, it will be very easy. But if I am going to critically reflect upon that event or chain of events, it needs contemplation with evaluation. So I need to have a balance of reasoning to get a proper output upon of the reflective questioning that I'm going to make. So I need to have some self-regulation to have this reflective questioning. And I need to have some pattern recognition capabilities, and I need to have a good sense of intuition. So if I am able to recollect or chunk out every frame of event that has happened, then I will be able to better answer the reflective questions, and then I can answer them. There are lots of cognitive biases that will bring in when I ask reflective questions. No, I'm always correct. Probably he is wrong, and that's why this event has happened. And then I'll brush aside things which, and it will not, probably I will be put up in a blind spot, which I may not even know about it. And I always judge myself and as well as others. So I always, it's a human error or human capability that we always think that we never commit errors. So see, these are all some of the disadvantages. So to overcome that, we need to be judgmental with curiosity about others as well as with curiosity about ourselves. So this is the framework for reflective questioning. So the question, we can ask reflective questions on, there are 16 patterns we can ask questions. One is based upon a knowledge or understanding what we know about the topic or the event, and what are the practice that what we did about it, or what are the outcomes, or how we are going to evaluate about that problem or event, and so on. So I have put the 16 questions based upon the communication skills course. So what do you know about my, so I can divide these 4 question contents into 4 question types: awareness about the knowledge, or analysis about the knowledge or alternatives for that knowledge, and action for the knowledge that I'm going to have about this communication skills. So similarly, I can frame my questions based upon the awareness, analysis, alternatives, and action of the practice or the outcomes or the evaluation. And then I can devise the question so that I can, if I'm a coach, I can work around this framework and devise questions so that I can ask these questions to find answers for these questions to help my mentee or coachee so that it will benefit him. I'll be sharing this PowerPoint so that we can, every one of us can go through these questions and try to answer in a better way. Do's and don'ts of reflective questioning. Do's is be authentic, be honest with yourself so that you can answer this question with, we can get an authentic answers to this question, because it's going to help improve ourselves. So we need to practice self-compassion. It's okay to commit mistakes. I need to acknowledge that I have committed mistakes. It's not a crime, but I'm always willing to open, accept it, and change myself. So after all, I'm asking this question. So if I had, for example, if I had beaten my son, and I'm not self-compassionate, and I'm feeling guilty, then I may not correct myself. But then if I have the thought process that what made me, what is the frame of my mind? Why did I beat my son? So that I can change myself in future, that I should not do that. So if I am compassionate with me, I will be getting a better answer so that will change my behavior or character. Writing it down, because our memory is very short. So I always say this, I have memory of a goldfish. Goldfish has got a memory of less than 5 seconds. So I have memory of goldfish. So if I write it down, I will always remember. I can go back and recollect and then work on it. And reflect on your values. So set your bar high and keep your values, and whether your actions are matching with your values. So if you reflect on your values, you will get some nice answers to the questions that you're having, and then you can work on yourselves. Seek outside perspectives. Just as I said, we are going to put ourselves in a blind spot, or blind spot always, not always, but most of the times. So I'm always correct. So that I never commit mistakes. So these sort of thoughts will come over to us. So if I get an outside validation, I pull in an expert, I call upon a colleague or call upon my wife or a friend who can criticize me constructively, then if I get their perspective of what's going about, it will be very, very useful. And express emotions, both positive as well as negative emotions. If I'm happy with the way I'm behaving, write it down. Oh, I'm happy with this. And if I'm not happy with this because of so-and-so reasons. So if I express emotions authentically and honestly, that will always help improve. So if the positive emotions will help in positive reinforcement, that will make us a better person. And acknowledge challenges. So I may have some difficulty. I want to wake up at 4 o'clock, do yoga for 1 hour, and then go for a morning run, and then go for a hospital. But I don't have enough time to do that because I sleep late. So there are challenges. My challenge is sleeping late and putting too much stress of 2 hours of workout in morning. I can chunk it out to morning 1 hour of yoga and evening 1 hour of walking. So I can, that way I can acknowledge my challenges and then I can work on myself by reflecting upon myself. The don'ts of reflective questioning are, don't rush. If we are going to rush about ourselves, we won't get insightful or meaningful reflection. So stay calm, cool, collected, and then reflect upon oneself. And then do not hesitate to ask questions to yourself, even if those questions are silly and stupid. So many a times, silly and stupid questions have got many more eureka moments. So always be open to ask questions to yourselves. And if some reflective questioning is happening, is asked by a coach, then never hesitate to give an honest answer. So one way of doing things is there are lots of journaling apps, or you can write it on a piece of paper or a notebook. I used to journal in a notebook so that it helps me a lot. So when I reflect back or when I look it back, I can say 3 months ago, I wanted to finish this course. I have written on my journaling app and now it's 4 months. And then it's like, oh, this was my deadline. So what is the work I'm doing for it? And then I'll go about it and then I plan accordingly. And these are the do's and don'ts. There are many more do's and don'ts of reflective questioning are present, but these are the major ones that one can ponder upon. We do not learn from our experiences. We always learn from reflecting on our experiences. So just as John Dewey rightly said, we need to have a reflective questioning or reflective questioning to ourselves or from an external coach or someone so that we can grow together. So I invite everyone to come together and go together and grow together by reflecting upon each other so that we all become a better person in all areas of life. Thank you very much for your patient listening. I'll be glad to answer your questions. I'll look into the chat box. So I think everyone has told it's relaxed, very relaxing, and calmness was felt. It felt great to be on the other side. Usually I try to get fellow learners to relax as an older person. Thank you. So thank you very much for the reflection. I think it was a very short 2-minute activity. Probably if I had more time, 10-15 minutes, I would have taken that in a very slowly manner, that it would have made much more sense to feel much more things. We can do that activity upon oneself. That's an activity for improving our self-command, that is control over our inner behavior, so that we can perform much better. So we can use tactile sensation, or we can sit and do it, close our eyes and do it, or moving. So depending upon what person we are, a visual person, an auditory person, or a kinesthetic person, we can use the activity in a different activity so that we can have a self-command. So it was nice to experiment with all of you with my thought activity. Thank you very much. Now I invite upon everyone to comment on the presentation and give your inputs. Thank you very much.
Thank you, Dr. Soma, for some wonderful, very detailed presentation. Actually, we went out of the scope of the topic because we were supposed to talk about reflective questioning as a way to teaching, or as a way of teaching, but you actually went into way to improve yourself. So I am sure everybody must have been benefited by your presentation. And it's a wonderful way to actually make people think and reflect on their behavior. Any feedback, any questions if you have for Dr. Soma, please. Yes, very comprehensive. I agree, Raminda. Thank you. Yes, Dr. Purnima, please.
Thank you, Dr. Sohan. It was very, very illustrative. I just want to share with the group 2 things, that we do practice reflective questioning as a normal way when we are part of a medical team or a healer's team, because we look upon situations and try to come back better. And so that's a very good way. However, one personal viewpoint which I have is that there is a critical period after a particular incident which we should not get into reflecting immediately, because we are governed by our emotions. We should reflect upon that situation immediately in a way, and then repeat it after some time, after we get over the initial shock, as a group or for ourselves. And second thing, I do appreciate your bringing the practice of journaling, which is now a very much recommended practice. And a humble suggestion which I have to the group is what I personally do, is that I use a locked chat on my WhatsApp in which I have a group with myself. So I journal early in the morning as well as at night, which is recommended. Here also, I would like to make a point and recommend to the group that please read up on something called as high functioning anxiety. High functioning anxiety, ma'am, sorry, I'm stepping into your field of expertise, but high functioning anxiety is often mistaken for motivation, and it is often linked to perfectionism traits. So all of us, if we read up on it, I also recommend a page on Instagram called as Calm, CALM, which has got good posts on it. Thank you for the opportunity to give my input. Very good going, Dr. Som.
Thank you very much. I have one point that
Thank you.
there's a critical. You told there's a critical period after any event. So when we reflect upon that, that may not be conducive. So I'm an simulation educator. So we do debriefing after critical events. So I'm being an anesthesiologist. I always there are two things called as hot debriefing and cold debriefing. So hot debriefing is what we do usually in debriefing scenarios, because when we are under extremes of stress, then if we do a hot debriefing, it's very easy for us to recollect the events, and then we can debrief. And when we are debriefing, we can diffuse the emotions, and then we can help them to calm down, as well as we can look back and we can give the ideal mental models or the frameworks for them to learn, and then that becomes very useful. So when we do cold debriefings in such critical events, maybe if some cardiac arrest has happened in the theater, and then a couple of days I give them time for diffusing their emotions, and then later on when I try to recollect, they would have diffused by themselves, and then they will try to hide up the facts or wash up the events, or many times they will not feel, or genuinely they will not remember what has happened. So at that point of time, then a debriefing or corrective actions might be pretty difficult. Now, what I'm saying is only for the medical debriefing or medical purposes. But when it comes to an personal or other psychological events, I do agree with what you're saying. Yeah. So thank you.
Point well taken, sir. Thank you.
Yeah. Thank you. Thank you for the points. Yeah. Any other question or feedback or comment anybody wants to add? So if no questions, no comments, thank you so much. Thank you all the presenters. You all did a wonderful job today. And we could accomplish 6 presentations, 3 in the last session and 3 in this session. I request the remaining participants to mention who all are doing in the next batch. So we close it here, if everybody is okay with the idea. And I'll be sharing the feedback form in the group. I request all of you to give your feedback. Thank you so much. Good night.
Thank you. Good night.
Good night, doctor.
Good night.
Thank you. Good night.